Good morning, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. So happy to have some time with you today. It is Thursday, so as many of you know, YWTV always shares the mic now on Thursday with Black women in our community. It's a great opportunity for us to hear some wonderful stories, to learn, to unlearn, and to just, you know, so much we've gotten from these conversations, and another great conversation we will have for you today. Um, my pronouns are she, her, hers. I said that. I'm the CEO, and off we go to talk today with Miss Tara Norman. Welcome, Tara.
Thank you, Helen. Glad to be here.
So Tara and I had the opportunity to meet very recently at a rally in Teaneck that we both spoke at. Of course, funny enough, prior to that, we actually had been on an email chain together because of her work at Planned Parenthood. And obviously, the missions of our organizations intersect for sure. So, we are aware of each other's work. We also have a whole nother connection, which is an important connection, which I learned that day, which is her mother is I didn't realize. I know her mother actually is our facilitator of our Circle of Care group, which supports women who are working on their reentry back into the community from the Edmund Mahan Women's Correctional Facility. Her mom is the amazing facilitator of our support group to support these women. And her mom also happens to be the mother of this rock star here today. So we are so grateful to learn of that connection as well. Tara uses the pronouns she, her, and she is a passionate advocate for all aspects of sexual and reproductive health care. And she currently serves as the education manager for Planned Parenthood of Northern, Central, and Southern New Jersey, where she works at the intersection of legislative advocacy and community education. From advocating for sex ed and abortion access legislation to implementing sexual health education programs. She takes great pride in the work that she does to ensure that all individuals receive equitable resources and necessary to lead healthy and empowered lives. So looking forward to talking with Tara today. So Tara, let's jump right into it. First of all, again, welcome. And I have to say, I was so impressed with your comments and your, participation in the rally. I am always grateful to hear, diverse voices come together to support these important issues. And, you obviously have been so entrenched in this work. Full force, both feet in, for some time. You have so much perspective to bring to it from, lots of different lenses. So I really appreciated everything that you shared. And clearly so did the group that was listening that day.
Thank you so much, Helen. No, I really appreciate that introduction. I just, love the work that I'm able to do at Planned Parenthood. And I so love being engaged with the community. In addition to, being a sexual health educator, I'm also deeply involved in our organization's overall fight for sexual and reproductive health care to ensure equitable access to comprehensive sex ed, abortion care, and improving maternal health outcomes. So I'm just so grateful that so much of the work that I am able to do touch so many different aspects of the needs of the community.
Well, and I have to say, I mean, obviously, this is a time where the work that you're doing is very much in the spotlight, as it has been, on and off for years and years and years now. But it definitely has stepped back in again, which I, know we're going to talk about. One of the places I know I talked about the intersection of our work and, where it crosses over. But obviously our work to eliminate racism and your work for health equity, are very, very connected. Can you talk a little bit about eliminating racism? I mean, do you think that that's possible? And, what are the steps that you personally are taking, to actively be part of making that a reality?
Yeah, it's a great question. It's an important question, and I think generally there are so many systems in place that continue to uphold racism, and we have to address the issue at multiple levels. Like, there's not just one answer. I think first off, like addressing racism begins with exactly what you all at the YWCA are doing. You know, calling it racism. It starts with having a lot of times uncomfortable conversations necessary to actually create change. And even though it starts with calling it racism, it can't end there in order for us to meaningfully create change. I think that the fight to end racism has to be reflective of the intersectional barriers that communities of color are faced with. And at Planned Parenthood, our fight to end racism includes the fight for improved maternal health outcomes and access to holistic and sexual and reproductive health care. Um, what's really important about this is that the right for access goes far beyond just reproductive rights. And that's one of the things that we talked greatly about at the rally in TNEC. And all of the other rallies that we're engaged in across the state. But it's really it's a call to ensure that access uh, is created for those who it actually has never existed for, and to ensure that a person's ability to receive healthcare is not determined by their race, by their income, by their zip code, by their immigration status, or by their insurance status. Now we're expecting the Supreme Court to overturn Roe v. Wade any day. And even more devastating than abortion rights being overturned is that for many people, for many families, and for many communities, these rights have never existed because rights without access are truly meaningless. The systemic barriers in place that block access to care within the healthcare system are racist. They're racist, and the Supreme Court decision will only further exacerbate the existing disparities. So we have to center the experiences of people who continue to not just be marginalized, but actually dehumanized by the entire healthcare system, by the immigration system, by the education system, by the justice system, by lack of access to housing and food. Because unfortunately, for Black communities, the list goes on and on. These communities have become forced to fight to survive in a society that really is saying, their rights, their families, their futures are less valuable than their white counterparts.
Right. And I appreciate you spending some time, focusing on the detail of that, because I know people who look like me, whose experiences, growing up white in this society, do not necessarily understand those access issues, do not understand how different it is for someone who does not look like us, who's someone who, is a different skin color, someone who does, is born in another country and comes here, that they do not have access the same way that we do. And it's obviously, and as a woman, we should understand the devastation that someone would feel at not having the ability to get the medical care, get the resources, get the information to be able to help them make the right choices for themselves, for their bodies, for their families. It is absolutely devastating. It's scary. The repercussions of that, impact generations, in their families. So it's so important that we're having this conversation again today. But we really need to stop having this conversation and start taking action so that it stops for sure.
Yeah, I think such a great point, Helen. And I think one thing that we can always center is that we all have the power to change the conversation. If this is the first time that your rights have felt, egregiously violated by government in this way, in this conversation about what's happening with the Supreme Court and Roe v. Wade, then challenge yourself to center the experiences of another community, of the Black community, who
Mhm.
this is not the first time for. So we have to take on that responsibility. Change the conversation with your friends, change it with your family, change it with your colleagues. But that's how we step up and take action. And it doesn't stop there. You continue taking action, but it starts with having the conversation and changing the conversation and centering the experiences of the communities who are most impacted and who have been impacted for a long, long period of time.
For sure, for sure. So, you mentioned your work at Planned Parenthood and your obviously, core commitment to maternal health, and looking at that specifically in the lens of in our Black communities and in our non-white communities, and how it's really a crisis what's happening here in New Jersey, in that area. Could you talk a little bit about how we can ensure that all individuals receive equitable resources, and really maybe just, and although we have put the spotlight on this conversation for our in our organization, and obviously our first lady has taken this on as being an area of focus, so there, here in New Jersey we have been talking about it, but I'm sure there's someone who's hearing about it differently today for the first time, so I would, please share so that we can learn.
Yeah, thank you so much for uplifting that. One of the core parts of eliminating racism and implicit bias is addressing the maternal health crisis. Devastatingly, the ability to have a safe pregnancy and healthy infant is not a guarantee for Black parents. Actually, on a national level, Black moms are dying at 3 to 4 times the rate of their white counterparts. And here in New Jersey, a Black mother is 7 times more likely than a white mother to die from maternity related complications. And a Black baby is over 3 times more likely than a white baby to die before his or her first birthday. So as long as racism is still an issue in this country, medical racism will be too. And we have to remember that the fight to end racial discrimination doesn't stop because we have a different president. There are
Mhm.
still many racists in positions of power, including doctors. And as a Black woman, it's terrifying to have to consider what this threat means for myself, for my community, for my family, and for my own future children. We have to be really, really loud about the fight to address the maternal mortality rate because these parents would be here today if not for racism. And just thinking about what that means for someone's family, for their community, for their loved ones, we have to take action. So we can start by standing with and believing in Black women and holding ourselves accountable and holding our friends accountable, and holding our communities accountable to do so as well, standing with and believing in Black women. When we do that, we can then use our collective voices to demand that doctors, nurses, and all other medical professionals do the same. Um, at Planned Parenthood, we're making strides towards improving maternal health outcomes, particularly in collaboration with our maternal health partners, which I'm just so, so excited about. We're all so excited about. In fact, we actually recently developed a lesson plan series that is at the intersection of reproductive and Black maternal health, and it's called My Black Health is Beautiful. And I just want to give a huge shout out to our incredible partners, Melanated Moms, New
Mhm.
Jersey Black Women Physicians Association, Salvation and Social Justice, and Southern New Jersey Perinatal Cooperative for their passion to serve the community and their dedicated work on this curriculum. And just thank you again, Helen, for sharing your platform with Planned Parenthood. And I also want to use this space as an opportunity just to uplift the amazing work that they're doing. Melanated Moms is a community centered
Yes.
women empowerment social enterprise supporting moms and women to become better versions of themselves through advocacy, education, awareness, and entrepreneurship.
Yeah.
Salvation and Social Justice seeks to liberate public policy theologically by modeling the hope and resiliency of Black faith, and envisioning and creating their own community led solutions to structurally racist society. New Jersey Black Women's Physicians Association is a nonprofit organization and network of Black women physicians dedicated to advocacy and the elimination of healthcare disparities within communities of color and other vulnerable populations. And Southern New Jersey Perinatal Cooperative improves the health of pregnant women, children, and families in South Jersey. So our partners are just amazing in their
Mm.
dedication to the community, and we've just been so fortunate, to work with them and be able to absorb the knowledge and the resources that they offer, to the community. So it's a fantastic partnership. The lesson plans include 4 individual lessons, actually, that each complement one another to empower the Black community throughout their full sexual and reproductive healthcare journey. And the lessons include holistic reproductive health, reproductive anatomy and physiology, intergenerational health, and self advocacy. So we're just really, really excited about what these resources mean for empowering the Black community.
Well, I thank you for sharing that. And Jay and Melanated Moms are an old friend of the YW. We actually honored her at our Racial Justice Awards a few years ago. We've done programs, with her, and specifically on this issue, as I shared. And the other organizations as well are just, stellar in terms of the work that, everyone is doing. And together, what a powerhouse group you all are. Not surprised that you put together this amazing opportunity for folks to embrace. For our viewers, we have the link here so that you can access, more information about the programs and the partnerships that Tara is referring to as we're speaking today. I do encourage you to connect and to learn, follow them on social media, go check out their website, sign up for their programs, and, check into utilizing, the many services that are available to you. And as always, I always encourage everyone to think about volunteering and donating. All of our organizations can do the work that we do because of the community that rallies around us and steps up and steps in to be able to support this work. And that's so important. So
Um,
please, Tara, that's.
and one last thing really important that I do want to uplift in the conversation around equity, and expanding abortion access. So fighting for not just rights but access, is that we're really excited that the New Jersey General Assembly recently introduced reproductive healthcare access legislation that seeks to expand access to reproductive healthcare services, including abortion. So just for folks to check out, the bill number is A4350. And this legislation would eliminate many financial barriers to accessing care by expanding insurance coverage for abortion care, expanding care for uninsured and underinsured folks, and allowing abortions to be performed by physician's assistants, certified nurse midwives, and certified midwives. Legislation like this is a meaningful part of the fight for not just rights, but for access. So we're really urging folks to call their legislators, tell them to support this bill, tell their peers about it, get engaged in our advocacy fights. In fact, there will be several rallies across the state of New Jersey once the Supreme Court decision is released. So please, please, please visit our website, ppactionnj.org, for more information on how you can get engaged in the fight. So we want to see folks come out, channel your frustration into advocacy.
Yes, and so obviously we are, in support. I mean, New Jersey does happen to, because of our governor, legislature took on, saw this coming, and started to put some pieces in place. But all the pieces are, to protect New Jerseyans for sure. But all the pieces are not in place yet. This is a key part of it, and so we do encourage everyone to educate themselves on the issue and considering supporting it. And also, I want to say that obviously YWTV is launched out of our Northern New Jersey hub of the YWCA. Nationally, we have YWs all across the country. I know Planned Parenthood is all across the country as well. Every state does not have the protections in place that we already have, even though we clearly are looking to put more, built in more. So if you happen to be listening from somewhere else in the country, I do encourage you to connect with your YW and your local Planned Parenthood to learn about what's happening in your state and how you can get involved. We know that the outcome of, we're all anxiously awaiting, the upcoming decision, and from there we'll mobilize as we need to, collectively across the country and locally in our states. But what we do know is the state you live in should not at all impact what you have access to, for
Yeah.
sure.
Absolutely. Thank you, Helen. And thank you for uplifting that. Yes, while abortion rights are codified into New Jersey state law, that does not stop the fight for access. That is number one in this conversation. Rights do not equal access. And that's what we're fighting to expand and make equitable.
So, we've covered so much already in this time that we've been together. I would be remiss in not asking you personally to talk a little bit about, your experience. I know we talked prior, so I know you're comfortable sharing that because, again, YWTV Share the Might Now platform is about having our guests share what they're comfortable sharing. This is your space and your platform. But, tell us a little bit. We've talked a lot about systemic racism in this very focused area, of a conversation to this so far today. Tell us a little bit about your personal journey and what you've seen, what you've experienced, and what you'd want others to know, especially those who look like me, to understand and our goal, obviously, with these conversations is to educate, to build bridges, to create understandings, to learn to respect differences, but embrace the places, that we should all, where we all cross over, for sure. But, again, the fight to support Black women is our fight as white women as well. We should be stepping up and stepping in. So, what would you want us to hear? No.
I appreciate this question, Helen. Thank you. I think for me and for a lot of others, a lot of times, as a Black woman, thinking about how I've been impacted by systemic racism and implicit bias can feel difficult.
Mhm.
I believe, as a means of survival, society has almost conditioned many Black women to believe that we must ignore the reality of racism and implicit bias in order to succeed in a lot of ways. However, a system that invalidates our experiences and conveys that we're the problem is certainly biased. But when I really challenge myself to go beyond the silence that I've adopted as a means of survival, it really brings me to reflect on my experiences as a student, where I often felt faced with implicit bias. I I can appreciate now that the strong passion that I've developed for advocacy and for community education, was not always encouraged along my journey. In fact, throughout my young adult education, it often got me in a lot of trouble. I was labeled as difficult, confrontational, loud, you name it. Actually, the term that I remember most is boisterous, because it was on my report card and I was too young to know what it meant.
Mm.
So I looked it up, and it's like noisy, energetic, rowdy. And I was, all of those things sometimes, but it was because I was passionate and I questioned authority and I spoke up for others. And I always said something when things didn't feel right. However, there was no value placed on my voice or my experiences. And although, there were times where it did feel isolating, I always continue to feel inclined to speak up for myself and for others. And now I'm very, very grateful that those early experiences with implicit bias have encouraged me to be a strong advocate for myself and for others. And I'm very fortunate to have made a career of utilizing my voice to impact change and to be a part of an organization so deeply committed to the fight for equitable access to healthcare and social justice. I think generally when I think about my work and the impact that I want to have in this movement, I think about the proverb that says, until the lion tells their side of the story, the tale of the hunt will always glorify the hunter. And I am just sincerely grateful to feel empowered to tell my story, and I'm dedicated to helping others tell theirs. And so I just want to thank you so much for the opportunity to share this platform and do exactly that.
Well, it's so generous of you to share so fully and deeply. And, it's you know, as white women, we shouldn't be asking Black women to do this work for us. We need to go on our own journeys to learn how to help. But you shared a very personal story about your, growing up in school and what was written on your report cards just now. And I just want to say to the fellow white women that are out there listening, you know, I hear that story, and I just want to make sure that you all hear that story and understand where and how you could help in that situation. I have a daughter, who could be going to school alongside a young Black girl, and that might end up on a conversation that I overhear about her behavior when my daughter's behavior is the same. It would be important to point out that why is she being labeled boisterous and my daughter is not? These are places that we can start the conversation and challenge what we hear and what we see around us, for those standing around listening to hopefully plant the seed for them to rethink what they're hearing, and also challenge the leadership that might listen to us differently than listen to Tara's mother, in that same situation when she was young. So I really do appreciate you sharing that story, and so everything you shared today. There's so much for us to learn, so many ways that we can get involved based on what you shared. Again, I want to make sure that everyone has seen the link here and takes the time to click it and learn more, follow all the social media platforms that you have access to also, as a result of the important work of Planned Parenthood. Northern, Central, and Southern New Jersey. Connect with the organizations that Tara also shared. And there are plenty of ways we gave you today about getting involved in legislative advocacy, about standing up individually, about organizations that you can learn more about and support, resources that you can share. Plenty of ways for you to get involved and be part of the solution and not part of the problem. So we do encourage everyone to think about which one feels right for you and jump in and do it.
Thank you so much, Helen. It's so great to be partnered with you all on these great efforts, and to be able to uplift the work that we're both doing and the amazing work of our partners. Folks can certainly download the maternal health lesson plans on our website, and visit our website ppactionnj.org for ways that you can take action in the legislative fight for access to reproductive health care.
Tara, thank you so much for being with us here today. For our viewers, thank you so much for taking the time to watch. I do encourage you also to think about someone in your life that would benefit from hearing this conversation and share the broadcast with them. That's another way that you can jump in and help spread the word. Tara, so gratefully and deeply, fully, articulately, shared so much in this conversation, and we want as many people to hear it as possible. So please be part of spreading the word. And for the YW, we will be back with more YW TV in the coming days. So please stay connected to us on our social media so that you can join us for our next episode. Always great conversations and wonderful community leaders that we are able to bring to you and educate you on what's happening around you, for conversations that are mission linked with our work. And we also encourage you to stay connected to our website, stay connected to our social media too, to learn about all the great programs that we have coming up for our seniors in our community. We have two great programs tomorrow, one on nutrition and health and one on the power of art, which is focused on the health of well-being, both free programs that you can get to by just clicking the link. And also we encourage any entrepreneurial women in our community, especially non-white women, to join our Eureka effort. It's a great opportunity to have a cohort support and a platform to help start and maintain and support your small business. We know economic equality is key to eliminating racism, and so we do encourage you to learn more about that opportunity. And of course, it's camp time. Part of the reason I'm outside is because my kids are home and inside, and there's no camp starting just yet. And so, with that, we would love to be able to support you, give you peace of mind that your kids are in great hands, safe hands, and learning a lot and engaged. And you can do that by checking out our camp opportunities. So with that, and again, we also have the link here for Planned Parenthood Action, nnj.org, so that you can learn more about, again, how you can be actively involved in the conversations that we are having today. So with that, we wish everyone a great day. Stay well. Thank you again for spending some time with us today. And my extreme gratitude to Tara for sharing so many important points and your own story with us. So grateful to you and all the women that have been on Share the Mic now. We've learned so much, and clearly our ability to step up is urgent, and we need to, we need to do it on our end for all of us to link arms together to move forward. So with that, have a great day, everyone. Thank you. And Tara, thank you.
Thank you, Helen. Thank you.